Hello everyone. The knee joint is the strongest joint in our body, which is responsible for our movement. If over the years the cartilage decreases, there is not enough nutrition, not enough blood circulation, the joint wears out, and problems with hip joint diseases begin. Today we will conduct prevention or initial treatment of problems with you. And let's do it one more time. Pull your knee to the floor and back to the starting position. Bend both legs and very gently, each at his own angle, spreads his knees to the sides. Try to touch the foot with the foot. If it worked out, press the toes against each other. While doing this very gently, the ankle joints are stretching. We press the foot against the foot, heel to heel, toes to toes. We stretch, we relax. We stretch. We've stretched the hip joints, the groin area, the inner surfaces of the thighs. We relax once again, gently stretch the knees to the side, stretching the hip joints. And enough legs at shoulder width. Lift the pelvis, squeeze the gluteal muscles, lower the pelvis and relax. And at your own pace, lift and squeeze, lower, relax. When we work with the hip joints, we necessarily strengthen the pelvic muscles, we necessarily strengthen the gluteal muscles. Squeeze, release. And once again, enough feet set wider. And the next task, we lift the pelvis and try to spread the knees, spread and lower. Lift the pelvis, straighten the knees, connect, lean the knee to the knee, sides, lower. And we work. Choose your own pace at which you only feel a pleasant stretch. We try not to bring it to pain, not to pull. And we lift again, bring together, spread apart, lower. Legs even wider if possible. We set, and one by one we try to pull the knee inward. Don't try to touch the floor all at once. Gently stretch the hip joints. And that's enough. Feet a little closer, alternately throw one leg over the other and gently push the knee away from yourself. Just push it away very carefully. And that's enough for relaxation, just for rest. At this moment, you can do 2 or 3 cycles of breathing. Inhale through the nose, exhale through the mouth tube. And that's enough. One leg is straight, the other is bent. We lift the bent leg and then inward, then outward. We work one leg at a time, then inward, then outward. Put the leg down, the same thing the other leg does. If any exercise causes you discomfort, doesn't work out, any pain sensations, skip these exercises. And that's enough. Circular movements alternately with each leg. We don't perform the amplitude all at once, as we know everything is gradual. Comfortable amplitude. To the inside. We all do things according to our feelings. No, overload the joints. Other leg. Our hips are strong, tightly pressed to the floor. Only the hip joint is working. Inside. And enough. Bend your legs. The exercise of stepping over. Each leg steps over to the side. This exercise is very good for the lumbar spine. I like it very much. I recommend it to you. Stepped over, turned around. The other leg stepped over and turned around. We step over. Berries are pressed to the floor. You can breathe in. Inhale, exhale, inhale, exhale, inhale on the stretch, exhale, inhale, exhale. This is a complex exercise. One leg has stepped over and we try to step over the other one. We return to the starting position in exactly the same way. Get ready. 1, 2. Inside, inside, we breathe. Inhale. Exhale. Inhale. Exhale, and once again, inhale, exhale, and inhale. Exhale. Perform this set of exercises every day. Stretch, strengthen your lumbar joints, subscribe to the channel, and stay healthy.